This is Dr. Gary E. Foresman, MD, discussing the final component of the basic nutritional protocol. We've introduced you to the multivitamins, to the fish oils. The final foundational part of any nutritional program has to be vitamin D, specifically a form of vitamin D3 that comes with K2 known as MK7, and we'll break those things down for you. Vitamin D3 is not a vitamin, so one important thing for you to understand is that you do not get vitamin D3 at all through your diet. Anything fortified in your food is a form of the vitamin known as D2 that doesn't even work that well in us human beings. So it's very important. D3 is a nutritional supplement that almost every single person needs. D3 is a steroid hormone produced with sun exposure, and you need intact kidney functions and liver functions. It goes on and on. The understanding of vitamin D today is that it is our most important cancer fighter, our most important immune regulator, the most important part of your brain health. So, and with the current levels, for some reason, we do not know why, the current levels of sun exposure people are getting, their vitamin D levels are often barely above sufficient. Vitamin D is something your doctor can measure. It's so important. The lab reference ranges are next to useless. You need a vitamin D level as measured on a blood test between 70 to 90. It's nanograms per deciliter, but it doesn't matter. 70 to 90 is what you need. However many units of vitamin D it takes to get your level to 70 to 90 is the right level for you to prevent cancer, to save your heart, to help with depression. It can do so many different things. Why do we need vitamin D? Lack of sun exposure. It's something to do with the environment that's keeping any amount of sun from producing vitamin D. You will hear this myth as well, which is all I need to get vitamin D is 20 minutes of sun 3 days a week. That has been shown 100% of the time to be the most ridiculous piece of advice that anybody can give you. You cannot get enough vitamin D by sun exposure like that. You could run around the equator naked and maybe make enough vitamin D to be optimally healthy. So instead of taking that fun piece of advice, why don't you just take a vitamin D supplement? Daytime, nighttime, doesn't matter, take vitamin D. Now, what does vitamin D do for us? One of the most important things, it's the body's best way of regulating immune system function. It can boost your immunity, and if you have autoimmune disease, it can decrease immunity. It helps the heart. It helps so many things. Why do we take D3, the kind that we find in humans? Because that's what we do. Vitamin D3, not D2, is the right form of vitamin D to take. Many doctors still prescribe vitamin D2 because it comes from a pharmaceutical company. Okay. Now, why do we take it with a specific form of vitamin K2 known as MK7? Because so many functions of D work so much better when K is provided to it, specifically vitamin K2. It's not meant to be confusing. There's a K1, there's a K2, there's a K3. The specific form of vitamin K2 has been proven to help prevent calcifications of the coronary arteries. Yes, help treat coronary artery disease. It's been shown to improve bone mineralization, especially when combined with vitamin D. So when we have a form of vitamin D known as K-Force, and yes, it is a vitamin D, D3, 5,000 units, along with this K2 at the right dosage, 180 micrograms of MK7, you have one of the more powerful healthy healing supplements really known to all time, and just one capsule a day usually gets your levels high enough as measured by a doctor to get the vitamin D level into the 70 to 90 range, which has been shown to be so powerfully helpful for the prevention of so many illnesses. Please go to www.middlepathmedicine and look up our whole PowerPoint presentation on vitamin D, because we have so many great articles on that. And if there's only one thing you took, which I'm not recommending just one thing, take this basic nutritional protocol, but please especially take vitamin D.